Welcome.
Thanks.
So I just wanted to thank you first for coming in today and talking to me. I just want to know what brings you in today.
My mom wants me to come in. I guess I got like a week ago. I got in a car accident. I hit a parked car, and I was drunk when I did it. And so my mom just wants me to come in and talk to someone, I guess, about it.
Okay.
I don't really know.
Okay. Is this because she's concerned? Is there any legal things involved?
No, there's actually not any legal things involved. When I hit the car, I just drove away, and I haven't really gone back to see if anybody was okay. But I just was kind of like scared. But she just, I guess, is just concerned because I was drunk when I did it, so she thinks that like I have a problem or something.
Okay. Do you feel like you do have a problem?
Not really. I guess in this time I shouldn't have drove. Normally I don't drive. Usually I just like sleep in my car after I'm done drinking. But this time I just I guess I thought I could make it home, but I don't feel like I really have a problem. I just know that I need to not drive when I'm drinking. So I know I shouldn't do that, but in terms of just like drinking, I don't think that is an issue.
Okay, so it seems to me from what I'm hearing is that you do know that driving under the influence is harmful.
Yeah.
But at the same time, it's not really an issue for you outside of driving.
Yeah, it's not an issue for me. I'm able to get to work on time. Like I said, I normally just sleep in my car. I didn't hurt anybody. I hit the car, but nobody was inside it, so it's not really that big of a deal, I think.
Okay. So today I'm going to be asking you a few questions about your alcohol use, and I want you to know from the get-go that during these 50 minutes, it's going to be your 50 minutes, and I'll not be making you or telling you what to do or telling you to change or forcing you to change. I'm here to be your co-pilot, and I'm going to collaborate with you to form goals that fits you, and we're going to try to build you up and try to form goals that are achievable and that best fits you. So for our sessions, I've outlined a couple of things that I expect, and I just wanted to go over them with you. Just
I'm intoxicated, so just don't show up drunk.
Yeah, and what do you make of that?
Just don't come here drunk, which I think I can do. I'm enforced. What does that mean? Just you're not gonna tell me what to do?
Exactly. So what we just talked about, I want your sessions to be personalized to you.
Okay.
And I'm not going to force you to tell me anything that you don't want to tell me, but I do want to highlight that everything that we talk about today and from now on in our sessions are completely confidential. The last thing on here is about the assessments. Okay. So release forms, we just talked about, but I need a client consent form to be signed every time we do an assessment.
Okay, okay.
Just so I have the permission from you that I can actually conduct this assessment. And the paper I need you to sign as well for the ISLA that we're going to be doing today. And I'll tell you a little bit more about this.
Okay.
The ISLA-Basic is an integrated longitudinal strength-based assessment. So what we're going to be doing is I'm going to be just asking you a couple of questions. It is a little bit lengthy. It's going to take about 30 to 45 minutes. Okay. And these are going to be questions that you've probably already answered before in your life. And some of the questions I might ask are like, what are some of your goals? What are some of your most memorable times in your life that you really felt like this was the best time, or times where you felt like this was your lowest time? Okay. So yeah, this is really straightforward, and we'll go through it together. You don't have to fill this out by yourself because it is a little lengthy, like I said. But yeah, this is the consent form for me to conduct the ISLA-Basic.
Okay.
And when you're ready,
Yeah,
you sign.
it seems easy enough.
Perfect. Thank you. And then, before we start, I would like to have some contact information that of someone that you feel that would be the best support system for you.
I can talk to
Someone you can talk to, or if you ever would like to, we can bring them into the session and really talk about our problems together as a group.
Do you want me to put one person or two people? Or?
However many people you would like, but one for now is fine. If you don't have anybody to put down, that also is okay.
Okay, I think I'm gonna put my sister down.
Okay.
Just because I feel like she's like kind of understands me a little bit more.
Good, good. I think that's a wonderful idea. If you're willing, I would like to know a little bit more about how alcohol use and any other substance use fits into your life, and what kinds of things you have been using, and what you've noticed with your use.
Okay. Sorry, what was the first one? Just kind of how alcohol plays a role, I guess?
Yeah, so how it fits into your life.
I drink with my friends, and so usually after work, I'm a waitress, and so like after work I'll usually go to the bar and I'll have some drinks with my friends, and sometimes when I'm at my house I'll like have like some wine, or I'll like make myself a cocktail when I'm just hanging out. So yeah, I guess it's social settings, and I guess kind of by myself too. I'll have some alcohol, and then in terms of other substance, I do smoke weed too, and I usually do it. I probably do it every day. Kind of sometimes I'll do it in the morning, or I'll do it after work, or just kind of like just like how people have like a glass of wine every day. I just kind of I just smoke every day. It's kind of my it's kind of how I release. Like sometimes I feel like I get really anxious, and I feel like weed and alcohol kind of both like mellow me out, which is cool.
Okay, so what I'm hearing is that this is something that you use to relax and something that you use to wind down. I'm curious though, when you're out with friends, do you also use it for maybe like social engagement?
Yeah, definitely. I feel sometimes like I'm like worried if I don't like have it, if I didn't have like a drink, or if I'm not smoking, I like almost get more anxious because I feel like I overthink it a little bit. So if I have like a beer or some alcohol, or if I like smoke, then I just like don't think about stuff like that. I just kind of get chill.
Awesome. Okay, so I want to know a little bit more about what you like about smoking marijuana and drinking alcohol.
I guess just kind of that it calms down my anxiety, and it makes me feel good. I definitely feel better when I'm like tipsy, or if I'm high, than when I'm sober. So I feel like, I don't know, my mom says like I need to come here, and again I get that I shouldn't be driving because you're not supposed to drive, even though I actually am a pretty good, smoking weed I think actually helps me drive better. But I don't think it really negatively affects my life.
Okay, so what I'm hearing is that it's something that's manageable, and you think that you have a lot of control over this, except the one time that you had the automobile accident.
Yeah. Okay. And that was only one time. Like I said, nobody was in the car, so it wasn't that big of a deal.
Okay, so it was low risk.
Yeah,
for you.
Definitely.
Okay. Do you have any difficulties in relation to your substance use at all?
What do you mean by that?
Let's see, like if you drink too much alcohol, and the next morning you are hungover, or maybe some days you aren't able to perform as well because you were hungover. Do you have any experiences like that?
I'm usually good about being able to kind of pull myself together, and that's also where the weed helps. Is a lot of times if I'm hungover the next day from drinking, then I'll smoke a joint in the morning, and then it kind of helps cure my hangover for work.
Mm-hmm.
But there has been times where I was supposed to like meet somebody or like give somebody a ride or something, and I just kind of blew them off, and not intentionally, but I was just like hungover, so I just like slept through my alarm.
Okay, so
But it usually doesn't happen. But I also work in the afternoon, so that's helpful because I can work in the afternoon, drink at night, and sober up in the morning, and then go back to work.
So I wonder, do you drink alcohol and then to relieve the symptoms of withdrawal, like hangovers, you smoke and then you relax, and then once you're ready to drink again, you drink, like in a cycle? Is that?
Yeah, I guess so. I've never thought of it like I'd have withdrawals from like alcohol or anything like that. But I guess
a hangover is a bodily response, and it's a withdrawal of that substance.
Okay.
Yeah.
I didn't know that.
I wonder, do you ever use marijuana and alcohol at the same time?
Yeah, actually, usually when I'm drinking, I'm also smoking too.
Okay. What are some of the feelings or benefits that you feel when you do that?
It kind of feels good. I feel like it's a good mix because like the alcohol just kind of makes me feel like loose, I guess, with my body, and then the weed helps my mind kind of feel loose. So
yeah, it takes off the edge.
Yeah, it definitely.
Okay.
I think it takes off the edge. So I think it works well, the two together.
Okay, great. Thanks for talking to me about this. I really commend your honesty and your openness with this process. Yeah. Can you tell me about your, like, a typical week with in regards of your use?
Just kind of like when I do it.
Yeah, how many times a week do you engage?
Probably every day. Definitely every day with weed, and then with drinking. Kind of when I have time to. If I'm going like straight to work, I don't have time to like drink. Then I usually won't. But if I'm out with friends, I'll definitely have a drink. On the weekends, I'll definitely have a drink.
Okay.
And it's usually like I don't know, usually like a few drinks, not just one. I mean, because I feel like one drink is just not like it's nothing.
Okay, so you drink during social situations.
Yeah.
Okay, and how many drinks do you think?
Probably like 3 or 4.
3 or 4? Okay. 3 or 4, and how many times a week do you think?
Probably like 4 or 5 times with alcohol.
Okay.
Yeah, and then every day with I smoke every day.
Okay. Got it. Okay. Well, thank you for letting me know. I am actually ready to start the assessment.
Okay.
And there's actually some parts where you can fill out on your own after the assessment. I am going to actually conduct this assessment with you. What is the most that you want help with throughout this process?
Man, I'm not really sure because I don't really feel like I like need a lot of help. Maybe just I don't know. I mean, my mom wants me to like stop drinking altogether, which is like not gonna happen because obviously I want to keep drinking so I can hang out with my friends. But I guess maybe be like safer about it because I don't want to, I don't want to harm anyone with my drinking. I just want to have a good time. So.
Right. So I hear that you do care about what your mom thinks, and you do want to honor her concerns about your health and safety, and that's very commendable. So what I'm hearing is that one of your goals and what you might want help with is to learn a little bit more about safer drinking to like lower the risks of what might happen when you drink.
Yeah, I guess so. Just kind of because when you like drink a little bit, you kind of I don't know, sometimes I guess I can be like a little irresponsible.
Okay, so let's address safety issues. And find safer ways to imbibe. Yeah. Okay, so what is your vision of your most hopeful, happy, productive life? What are your most important life goals for you?
Well, right now I live with my my mom, and so I definitely I want to be able to like get my own house and all of that. So kind of just being able to move out, being able to. I really like art, and so I would like to do something with maybe like painting or drawing. I don't know how realistic that is, but it's something I like doing. So.
Okay, so what I hear is you would like to become more independent and have autonomy.
Definitely.
Okay. And how would you like to make progress towards those goals?
I don't know. I'm not really sure, to be honest, because I don't really think. Again, I just don't really think I have a problem fully, so I don't know how I can really make progress. Because I don't want to cut down on my drinking, and I don't want to cut down on smoking weed. I guess I just want to be smarter about it. I don't know, if that makes sense.
Do you see your substance use fitting in with the goals of being independent and being on your own and doing your art? And
I guess so. I mean, I don't really. Part of me living with my mom is because I can't really afford to move out, but I don't really know how I can change that. I tried going to school for a little bit. Like I went to community college, kind of on and off, but I just kind of kept. Like it was just really hard to kind of focus, and so I just kept dropping out of classes. So it's kind of hard because I just feel like I can't like make more money to move out if I don't like get a degree. But it's just, I don't know, it's such a process. And then with my boyfriend, sometimes I'll like stay at his house overnight, but not all the time. Usually I'm just with my mom.
Okay, I see. And when you're with your boyfriend, do you usually drink with him?
Yeah, and that's actually I started smoking weed when I started hanging out with my boyfriend. And kind of he really likes to smoke, and he kind of does like a little bit more. My boyfriend does cocaine sometimes, or he'll do like ecstasy or things like that. So he kind of does, I think he's more intense than me. He should probably be here actually than me, but so, and sometimes I'll do different things with him. Not usually, but I've done cocaine before, and I've done like prescription drugs before, but not typically.
Okay, can you tell me a little bit more about the cocaine use?
Just kind of when I've been at parties and stuff. If somebody has it, then I'll use it, but I've only done it a few times. It kind of like it hurts my head a little bit when I do it. So
Okay.
I don't like doing it all the time, but I have done it before.
Okay. How often?
I've probably only done it I've done it 6 times.
Okay.
In I don't know, I guess in 2 years. So that's not that many times, I think.
Okay, so it's very manageable, and what I'm hearing is it's something that you do very occasionally, and that it's not something that you would regularly use due to its effects on you.
Yeah, I don't do it all the time.
Okay. And you would say that marijuana and alcohol is much more enjoyable to you?
Yeah, definitely.
Okay.
I like those effects.
Okay. How do you spend your time on most days? Can you describe me a typical day?
I work a lot of days. I probably work 5 days a week, 6 days a week, and I work in the afternoon, so it's typically I wake up, I'll maybe smoke, I'll watch TV or Netflix or something like that, and then I go to work, and then after work, me and my coworkers get off at the same time. I work down at the beach, and so I'll hit up some of the pubs or bars down there, and have some drinks. So that's and then go home and kind of start the day over again.
Okay.
So that's kind of typically how it goes.
Got it. So, would you say that perhaps the most immediate risk is getting physical with your boyfriend last week?
Yeah.
Or was it the accident? Like, what do you think is the biggest risk for you right now?
Maybe getting physical, because I feel like the accident, I know I shouldn't drink and drive, but with me and my boyfriend, I guess getting physical, it just kind of happens when we're intoxicated.
Mm-hmm.
We're both like getting each other's faces a little bit.
Was that the first time?
No, not really. We've been physical with each other before. So we'll like yell at each other and like we'll like push each other kind of. But it usually happens when we're both like drunk.
Okay.
So, you know, we just get like super drunk fights and then like we'll like get at each other. But, you know, I know that's like kind of normal. But.
Okay. So, you do feel that it is the most immediate risk that you would like to really focus on, yet it's something that you think happens once in a while.
Yeah.
Okay. So can you tell me a little bit more about that? Because I don't know how those two things fit together.
I guess this just happens once in a while, but I don't want it to happen, so I'd like it not to happen, and I guess just kind of me being, I guess, like safer and kind of know how to handle drinking, but I don't know, I feel like I can like handle it. It's like, you know, other people like are the ones that are like contributing.
How much and how often does he drink? And do you think that contributes negatively toward your behavior when you drink?
Yeah, I think he probably maybe drinks every day. And it does. I think he bugs me when he gets drunk. Like, I don't know, he just like gets all up in my face about stuff. Like, he'll ask me a question and I'll answer it, and then he like keeps trying to get answers out of me. I don't know how to explain, but he just like bugs me, and it just like makes me mad, and then he gets mad because I'm mad, and it's just kind of like, I guess, a cycle.
I see. So what I'm hearing is, you know, you're trying to enjoy yourself, but then sometimes there's this negativity that kind of clouds over both of you and turns a good night into a bad night.
Yeah, definitely.
Okay.
I feel like I don't like drinking with him really, because he just like gets negative, and he like I just always try to have a good time. That's what I do with my friends, and you know, and it, like I said before, it helps my anxiety. Like, it's like I think it's like a medical thing. I like use it as medication to help my anxiety, but he just like doesn't like is mean about it. So.
Okay. Thank you so much for sharing that with me. So, like I said before, this assessment is to highlight and build on your strengths so you can be more successful.
Okay.
And I want to know a little bit more about how your previous period of success has helped you in your life, and maybe a time where you feel more stable than right now. And let's start with the most recent period of success. When did you feel that you were the most stable, and that's your own interpretation?
Okay. Maybe like a year ago, I felt kind of more stable, because I guess I was in school then, and I was doing well in my classes, which is like unheard of.
So you would say like good grades?
Yeah, I was getting pretty good grades, and I had a different boyfriend then, and we got along really well.
Okay.
And he went to school with me too. We were in the same class. That's what we met.
Okay, so healthy relationships.
Yeah, we did like our homework together and stuff like that.
Okay. So what I'm hearing is you find stability through productive work.
Yeah.
Is that something that you would agree with?
Yeah, I would agree with that. I just, it felt good because I'm just not very good in school, and so the fact that I was getting good grades, I felt really good about myself.
Yeah, I'm sure that was something that brought a lot of happiness and reassurance and reinforcement to you. Let's see. When did you feel the opposite? So the least stable.
It's probably like maybe a month ago. It was just, I guess I was just, I guess me and my boyfriend were fighting a lot. My new boyfriend, we actually, my old boyfriend that I was fighting about, we broke up probably like 9 months ago or so.
Okay. So do you know what month that was?
Maybe in like last July.
Okay.
Or like August-ish, like kind of towards the end of the summer.
Okay.
He moved away, and so I don't know. I guess he just moved away, and it just kind of like bummed me out. And then I went back to school, and I just like it just was kind of like hard for me. Like the classes were harder, and I didn't have like he wasn't there to like kind of help me, and so I just kind of started getting discouraged a little bit.
I see. Let's see. So. Okay, do you have any other periods of time where you felt the stability and success in your life that you want to add?
I mean, not really. I guess I like doing well at work too.
Okay.
I feel like a few months ago I was kind of like, my manager right now is like really mad at me because I guess what we were saying earlier, I showed up late a few times, so he's kind of been just like kind of mad at me because of that. And so a few months ago I was just kind of like new at my job, and I felt like I was doing really well, and now I feel like I can't do anything right. So
Okay. So I want you to rate these 3 things. So this is a year ago when you were describing me about your relationships. Then last July when school was difficult and when you had your breakup. And then right now currently, will you rate what is the least favorable? So 1 least favorable to the most favorable.
Okay. Just kind of putting numbers by.
Yeah, you can just put the numbers by each.
Okay. And then I guess so 1 I would say would be my past, and then 2 present, and 3 would be right here.
Okay. And then will you describe any stressors that might have led up to the difficulty in school and the breakup?
Just kind of like, I guess, just fighting and just, I mean, in the breakup, we were like, not really getting along, but it was more because he like went to a different, program, and so he had to leave, and, I guess I just kind of had a hard time dealing with it, and so with that I just kind of like lost motivation a little bit, and that's kind of when I got with my boyfriend now, and like I said, he's really fun, and I really like him. He just like, sometimes he gets like mean, and he's not like super like, he's not in school either, and so he just kind of thinks it's like a waste of time.
Okay. And can you tell me a little bit more about how the drinking fits into the difficulty in breakup? Was it a part of it?
Well, so I was drinking before, and smoking. My boyfriend before smoked too, but it didn't seem to affect me as much, and I guess I just kind of started drinking more, especially after we broke up. I just kind of wanted to like I guess, like, feel loved, maybe. And so I went out to a lot of bars and, like, and hooked up with people and kind of just started drinking in that way. And that's kind of why I started going out more, was to kind of, like, meet guys and just have fun with my girlfriends and just not, like, don't really care about stuff as much.
Okay. So what I'm hearing is you would use alcohol kind of just to take the edge off of the breakup and kind of forget about some of the issues.
And kind of, I guess, you had to be social.
Okay, yeah. It does make you social. Okay. Can you tell me a little bit about your early childhood experiences? So that's things like place of birth, just culture, language of origin, any key life events that really stands out for you.
Okay.
So anything you'd want to tell me.
Well, I was born and raised in San Diego.
Okay.
I don't really feel like I identify with a culture. Like, my mom is kind of just white and my dad is white and just, like, I guess I guess I identify with being American.
Okay.
And then growing up, my parents were kind of like, just let me and my sister do whatever we wanted. Not like spoil us, but they just didn't seem to they didn't really care if we went out with our friends or if we I remember walking to my friend's house who lived probably 8 miles away, and my parents just didn't care. They were like, yeah, it'll be fine, it'll be fine.
Okay.
So
it sounds like they're very permissive, but they were still very, they still wanted to highlight your autonomy as a young child. Would you say that? Do you think that they were trying to, foster independence in you, or?
I guess so. Sometimes I feel that way, but then sometimes I feel like they just didn't really care.
Okay. I see.
I feel like the reason, I mean, I'm sure my mom does care about me, but I kind of also feel like she just is sending me in here because I wrecked the car and I'm causing her to have to pay money, and so that's why it's an issue. If I wasn't if it didn't affect her, I don't know if she would really care.
Okay. So that's really interesting. I want to talk a little bit more about that. So at the beginning, I was hearing from what you were telling me that she wants you to come in because she was concerned about your health and safety, yet there's something in you that tells you that she's just wants you to figure out what's going on with the car.
I feel I mean, I'm sure she does care, but just when, I mean, back to when I was having my breakup and stuff like that, I feel like she didn't care. She was like, oh, you're pretty, you'll find somebody. But I was it was a really hard time. And then just when I was didn't care about school until I started doing poorly, and so. And she's like, oh, I'm wasting money on on your tuition. So I don't know. Sometimes I just feel like if it affects her negatively, that's when she seems to start to care.
So it feels like in order for her to react, you need to incite some negative reaction.
Yeah, and I don't want to do that. I'm not trying to get her attention this way. If anything, that's like what we were saying earlier, I want independence from her. I don't want her to really be in my life. I want to do my own thing.
Right. You want independence, but you still want that support system that's going to be unconditional.
Yeah. And I feel like that's normal, right?
Yeah, it really is. Will you tell me a little bit more about your school history? So, high school, can you tell me a little bit?
I didn't do too well in high school. I was always kind of a C student, barely getting by. I did well in art classes, and I did theater growing up, and so stuff like that. I liked doing, but I guess academics, I just especially math and science, it was hard. It's just hard for me always. I feel like it was just harder for me than other people. And then once I got into community college, I like, the first like few semesters I was with my old boyfriend, and you're kind of holding each other accountable, and then it just got hard, and the classes are just like really hard, and it's just like such a process.
Okay, and going back to high school, you went all 4 years and you received your diploma?
I did get to go all 4 years. It's
Okay.
very, I don't know, I feel like I said, I feel like I like barely scraped by, but I did graduate, so.
Okay, that's all that really matters, right?
Yeah.
Can you tell me a little bit more of about the length of your college career and if you're still taking classes?
Yeah, I did like I guess like some full semesters, and then after that I would take some classes and I would drop them, or take some classes and drop them.
Did you have a major in mind or anything like that?
Not really. I was kind of thinking about doing something with art, but that's like not. Like, there's no actual jobs for like artists really, at least not ones that like get paid well. So I just kind of gave up on that.
See. But from what I was hearing earlier, it seemed to like something that really calms you and helps you focus. So even if it doesn't turn into a career, it can be a hobby that's going to be really helpful for you.
That's true.
Yeah. I want to go through your family history just so I can see if you're susceptible to any diseases or disorders or any substance abuse.
Okay. Is that like just like how likely I am?
Yeah, just going down the line, just thinking about who has a diagnosis or who you know of that has certain problems that really stick out.
Okay.
So let's start with your immediate family members.
I don't know if anyone has anything. I feel like my mom must have something, but I don't know what she has. Maybe like a personality disorder or something.
Okay.
I don't know what the personality disorders are, but I don't have anyone in my family who has anything like a mental disorder like that's like crazy, I guess. My mom does smoke cigarettes. Is that something? Yeah. She's like a 2-pack a day smoker.
Okay.
She smokes a lot.
And this is, you live with your mom.
I do.
Okay. Any other close relatives that you might?
I have my dad. My dad will like drink a little bit, but not too much.
Okay.
I don't live with him. He's my parents are divorced, and so my dad kind of lives
Okay.
probably about like 2 hours away. So I see him sometimes, but I'm mostly with my mom.
So this is something. This is stages of change, and this is something that we use with substance use. And I'll show you something that probably will make a little bit more sense. So this is a wheel, and you can see that it's in a circle.
Mm-hmm.
And so this is called the 5 stages of change. And for this assessment, I'm trying to figure out where you are in this wheel. And the purpose of that is to figure out where we are in our progress, in our and I am going to be asking a couple questions for you to kind of determine where we are. And so after we determine that, we know where we can start and what kind of goals and plans and treatments that we can help you with.
Okay.
Do you have any questions about this?
Just by reading it, I guess like probably like these first two, like pre-contemplation and then contemplation. So what pre-contemplation is like, I don't think that I have an issue, and then contemplation is like maybe I do. Kind of.
Yeah. So let's read it together.
Okay.
So pre-contemplations, you may think it's an issue, but I don't. And even if I do, I don't want to do anything about it, so don't bug me.
Okay. That's kind of me.
You identify with that one?
A little bit, yeah.
Okay. Contemplation. I'm willing to discuss it, think about it, and consider whether to change, but I have no interest in changing, at least not for now.
Oh, maybe actually that, just because I guess I'm here, so I'm talking to you about it.
Yeah.
So.
I hear a lot of willingness and willingness to give it a try, it does sound like contemplation. So this one sticks out to you the most so far?
Yeah.
Okay.
The next one is what preparation, and I'm ready to start changing, but I haven't started and I need some help. I guess, yeah, I'm not at that stage yet.
Okay.
Yeah.
And action is when we actually make concrete plans.
Okay.
And so let's read this. I have already begun to make changes and need some help to continue, but I am not committed to maintenance. And I'm working toward maintenance, but I haven't gotten there and need to get some help to get there. And maintenance is basically when you're stable and trying to stay that way for as long as possible, even if life throws you a curveball and you might be alarmed.
Okay.
What this part doesn't highlight, which I want to highlight here, is that relapse is a part of the process of recovery. Relapse is actually more common than actually maintaining sobriety or maintaining these goals that we put into action. Yeah. So I want you to know that even if we get to maintenance and you relapse, that's okay. And as you can see, this is a circle, and it's not linear, which means that our progress is not going to be one straight road. It's going to take detours, and there's going to be hills and valleys, and there's going to be curveballs. And what I'm here to do with you is when life does, throw you a curveball, how are we going to handle it together, and are we going to stick to the plans and goals that you have made for yourself?
Okay.
Yeah, and how do you feel about that? What does that sound like to you?
That sounds good. I just I don't really feel like I have a huge problem with alcohol and smoking, and so I feel like when it says relapse, I think of like what you see on movies and stuff, like 6 years without a drink, like 12 months without a drink, and I don't want to do that. I want to keep drinking, and I want to keep smoking. So.
Okay, yeah, and I want to let you know that there might be a misconception, or actually there might be some sort of rhetoric around any type of substance use that abstinence is the only way to
that's what I see on TV.
Yeah, and that is the rhetoric that is pretty dominant, but abstinence isn't the only way that we can help you. So and sometimes it's not a realistic goal. So what we're going to do is we're going to take baby steps, but we're going to make those baby steps together, and you're going to be in charge of that. This is ultimately all up to you, and that's why it's not going to happen overnight, and I'm not going to tell you to stop drinking, right? But what we are going to do is we're going to find ways where we can keep you safe, so things like the accident or things like violence doesn't happen to you ever again. Okay? How does that sound to you?
Yeah, that sounds good to me.
Okay. And so you said that you're in, you feel like you're in the contemplation stage?
Yeah,
I identify with that.
I would say so, because now that, coming in, I didn't think that I really had a problem. And I still, like you said, I still don't want to stop drinking, but I do feel like maybe I could change things to make it, just kind of stay safer. So.
Yeah, so I hear and feel that you are open to different avenues in terms of safer drinking habits. Do you have any suicidal ideations?
No.
No? Okay. And how would you describe your sleep patterns and appetite?
I feel like I can sleep well when I smoke. That's usually, sometimes I smoke like at the end of the day just to kind of fall asleep. Same with eating. I feel like I don't have a problem, but I get like hungrier when I smoke.
Okay.
When I drink though, sometimes my sleep pattern kind of gets messed up a little bit. And I just isn't
That's normal.
Okay, yeah, that's what I've heard. It's pretty normal. But if I smoke and drink, I can typically fall asleep.
Yeah, some of the symptoms with drinking is that it will mess with your REM cycles, and so you will actually have poor sleep when you drink.
Oh, okay.
Mhm.
I guess
And
I
so-
didn't feel that way.
Initially, you'll fall asleep really easily because it is inhibitory, so which means it will depress your body and relax your body to the point where you will fall asleep. But that's not always the case, and when it's early in the morning at 5 o'clock in the morning, you wake up and you can't fall back asleep. It's
Yeah.
actually something that happens very often with drinking.
Oh, okay.
So I wanted to go back to the sleeping and your use of marijuana. Do you use marijuana for a sleep aid, or is that just something that happens just
I use it
antecedent to sleeping?
kind of I use it for a sleep aid, but typically I'm usually smoking at the end of the day anyways.
Okay.
And so it kind of like plays both roles, I guess.
Okay. I want to ask you a little bit about or let's just talk about right now. How do you feel like your cognition, attention, memory, this recall has been for you?
Probably not that great. I'm pretty forgetful, and I kind of feel like I'm all over the place sometimes. That's kind of how it was with school. It was just like, it was kind of hard to I guess retain the information. But I feel like I've always been like that, just kind of distracted, I guess.
Okay. So we're almost at the end here. Thank you so much, by the way, for sitting through this. It is a little
No
lengthy.
problem. It is very lengthy.
Yeah, sorry about that. I want to talk to you about some of the strengths that you feel that really help you during a stressful situation, such as the accident or the violence.
I guess probably talking to my friends. That definitely makes me feel better.
Okay. So your communication is something that you feel is a strength.
Yeah, definitely just kind of being able to just kind of talk and hang out with my friends, I think helps.
Okay.
And then probably, I don't know if this sounds silly, but probably drinking and smoking helped me kind of, like with the accident, the next day I was really stressed out, and the first thing I did was I had a drink and I smoked.
Okay.
Because I was just I was super anxious because I was scared that I was going to get caught or something really bad was going to happen.
Let's see. Any other strengths that you would like to highlight?
Just kind of things I do.
Yeah. So, what kind of things that you do that help you in times of stress?
But my friends always say that I'm funny. I don't know if I'm funny, but I guess I kind of make jokes out of things. So.
Yeah, humor is a great tool.
Making light of situations, I guess.
Yeah, and so you use humor to highlight positive.
Yeah.
Okay. I think we're actually all done with the assessment.
Oh, okay.
How did you feel about the assessment? What was it like for you?
I thought it was interesting because I kind of came in very much thinking that there wasn't really an issue, but it was kind of interesting how it kind of especially kind of looking at the timeline, it was I kind of saw how when I said my life was going really well, and kind of seeing it seems like my breakup kind of made things kind of spiral. So it was interesting seeing that because I never really thought about it too much. So
yeah, so you learned a lot about yourself through that assessment.
Yeah, definitely.
Okay, that's good to hear. Thank you so much for cooperating. I know this was lengthy and a little bit tedious at times, but this helps me get a better understanding of you and to better help you. So thank you again. So before you go, because we're almost out of time, I want to make our next appointment for next week.
Okay.
Yeah. same time next week?
Yeah,
Same
I can
day?
do that.
Okay.
I like talking to you.
Great. And then also, something that we're going to do next week, which is it's going to be very exciting, is I'm going to be interpreting the results of the assessment that we did.
Okay.
And also going through and seeing what I found and really going through it with you and seeing what kind of goals that we can come up with for you. In the meantime, I would like you to look over these pamphlets about marijuana and alcohol use, and it's just homework for you to just read over and kind of keep in mind when you do engage in use
Okay.
activities. Yeah, just because, we talked about trying to practice safer drinking habits, and so I think just knowing the risks involved could help
Okay.
with that.
No, definitely, because I mean, I don't really think about how it could be, I guess, high risk. Okay, I can look at that.
Okay. Well, thank you so much for coming in today, and I'll see you next week.
Okay, thank you.